Welcome everyone to Aging in Action, and today we're very happy to have with us John Richer and Peter Marshall. And hi, gentlemen.
Hi.
Hey there.
Hi, and we're going to be talking about a new initiative called Links to Wellbeing, Social Prescribing for Older Adults. That's a lot of words. But
do we have an acronym for that?
Actually, no, not yet.
Not yet. Eh? So tell us a bit about this program. What's the aim and who are you trying to help and what it's all about?
Okay, well, I can get started here, Pete. The social prescribing is something that we've just begun really about a year and a half ago. We've been trying to enlist the help of physicians to help identify people who are lonely or isolated, seniors who are lonely or isolated in our community, and link them to meaningful social opportunities, which we do in abundance. Like the Parkside Centre, that's our main bailiwick. We have all kinds of different programs and computers and arts and crafts and fitness and wellness and that sort of thing. But the main thing that's inherent in all of those programs is the socialization that takes place either as part of the program or happens before or after, with the people staying around afterwards for coffee or lunch or something like that. So we want to sort of reach out to those people who haven't been getting that regular diet of socialization and sort of supplement that for them. But people who are isolated are tough to reach sometimes, and while we can put out brochures or advertisements and stuff like that, those most of the times aren't reaching the people, and the ones who do tend to see them most often or identify them most often are their private healthcare physicians or other healthcare professionals. So we're really reaching out to them to tell them about what we're doing, what sort of activities do we have, and how is it that we can help these people. So really, I think that's it in a nutshell.
So certainly with COVID, it's probably been even more important to reach out to seniors who were so isolated, away from loved ones and their friends, and it's very important. There's a lot of people suffering with mental health issues because of this.
Yes, absolutely. We said we started our Parkside Centre with a Walls program, which is a virtual senior center. We do programs over the telephone or virtually on the computer. And when we did that, when we did bring that here, it was right around the time the CBC News had declared social isolation as an epidemic in Canada, well before COVID ever came along. So you can just imagine how those feelings of loneliness and isolation have really grown in our country, really, but our community as well. But yes.
Sure.
So, John or Pete, whichever wish to answer. So if we're looking at our local community here in the Greater Sudbury region, what's the onboarding from physicians locally been like to participate and, to share that information? Has it been a strong response?
Well, and Pete can speak to this more, but really, just of late, we really made a lot of inroads in that regard. But Pete can speak better to the sort of the barriers we're facing to get through to the physicians throughout our time with the social prescribing. Big reason, I think, and Pete, you can corroborate this if you will, but I think a big reason is a lot of the family health teams or the clinics, the medical clinics, are really spending a lot of their time on delivering the vaccines, and didn't have a lot of time to consider other things. But Pete, you want to carry on that thought?
Yeah, there's that, and the flip side of that is that with COVID, there's a lot of the doctors are doing virtual appointments. So to be able to get a document in front of them where they have the time to read it and accept what's happening and to understand and maybe to book a phone call. It was a little bit difficult over the first year with the openings and closings again that compounded the problem, if you will. But as John said, since the start of the year, we've seen an increase in client referrals to us, and we're happy that we're able to help as the referrals come in.
So when we talk about prescribing, is the participating doctor, are they actually writing a prescription for their clients and saying, do this?
Yeah, it's basically that. It's instead of providing a prescription for medication, they're giving the patient a prescription that says, call the Parkside Centre with our contact information on it. And there's a few check boxes. So they might understand that this patient needs a little bit of light exercise or socialization, that kind of thing. At the same time, the doctor's office then sends us a referral form in a secure environment. And then we would reach out to the client initially and assign a volunteer to work with them to try to get them involved in something that makes sense and makes a difference for that client.
I think that's amazing. I mean, just the factor that the doctor has prescribed it makes the prescription that much more real, right? If the doctor says, I need it.
That's exactly it.
Older adults tend to listen to their doctors more than, their children saying, Mom, you should go out. If the doctor says it, right, it's probably a lot more impactful.
Yeah, exactly. And they don't have to search for our contact information. So it's a firm piece of paper. So when they get home, if they don't remember everything the doctor said, they've got a reminder. And then they can initiate the call, but they can rest assured that I'm going to call anyway when we get the referral from the physician or the nurse practitioner or the nurse or the paramedic. Any of the associated healthcare professionals are able to do that and provide a prescription to these clients and refer them to us.
So that,
sorry, go ahead.
Sorry, that's okay. So that opens up another conversation then. Do the individuals that are seeing their healthcare physician, nurse practitioner, does it also encompass an optometrist or maybe a pharmacist or anyone who maybe they're seeing quicker than a physician itself? Because
I can say that we're expanding as we go.
Okay.
So for instance, community paramedics in Sudbury were a group that we discussed this with initially, and we have a presentation coming up with them. As we get other groups of health professionals asking the question, then we will ask the question of the Links to Wellbeing people. This is a 3-year fully funded program by an anonymous donor. And so there are specific steps that we have to take to fit into that program. There's about, I think, 22 to 25 centers in Ontario that are doing this. It all started, social prescribing has been going in the UK for years. And in fact, it's funded through their National Health Service. In Canada, the Rexdale Community Health Centre in Toronto started off the process in Ontario, and they went to the Older Adult Centre Associations of Ontario to see if they could roll it out to some test cities. And with our big geography and relatively small population, we were a natural fit to start with this. And then Links to Wellbeing, the Alliance for Healthier Communities came in, and we've been on a go now for a year, and we've got 2 more years left.
I think it's a wonderful initiative because mental health affects so much about a person. Just a requirement for extra drugs. If your mental health isn't well, then it leads to all kinds of other health issues. So I think it's a very isolation and loneliness is such a huge thing, especially for seniors shut at home that have no contact with, minimal contact with people. I think it'll be interesting to see, if at the end of, or, over the years, how you see what's happening with those people. Is their health improving? Are they using less drugs because they depression and all of that just leads to so many things.
Right, exactly. And just tracking is an important part of the product. The trained volunteers would be staying in contact with the clients that they work with at 3 months and 6 months and at 12 months to identify if they were able to continue participation, if they expanded participation. That's kind of what the study is designed to do, to find out what works, what doesn't, how can we improve it. It's really quite amazing.
And just to add to that too, Gwen, they in Rexdale, they have those stats already. They have been tracking their clients for an extended period, and they have come to that conclusion that there's less emergency room visits, and there's their general well-being is much better than it was beforehand.
Yeah.
Well, and perhaps to whoever is connected with the senior, they may see something or identify some issue that might get missed in between visits to doctors or healthcare professionals. So they might see something that says, okay, I think you should call your doctor. Or I think that's just, the more I think about it, it's such a thing that could bring so much to people. And really, it seems like such a simple thing, but it involves, it's much more, I guess, just the whole social aspect, health aspect. I think it's a wonderful program.
Yes. Yeah. Well, we're really pleased to be bringing it here to Sudbury, and it's an important program.
John,
So-
like I know we have here, like we've got Parkside here in Greater Sudbury, and I mean a wonderful go-to hub for so many of us. How far geographically can this program work right now for our residents in our community? Like if they're in, let's say, Massey or Espanola, like how far out is it right now relevant for us here in the north?
Well, for people out that far, like we do have them involved. We do have members in those areas involved with our Parkside Centre Without Walls programming. So we do have, like we say, over the last year, we've had people on those phone calls or in our other programs from French River to Timmins, and from Manitoulin Island to North Bay, just different people there. So we do feel that there's room to expand there. That's one of our goals, is to try and, one of our goals for this coming year is to expand further into those areas, because, we feel that there's still a high number of seniors, who could be at risk of isolation or who are already there. And we want to help them out as best as we can. Now for like, just in the city of Greater Sudbury, let's say, we have the ability, we have good relationships with the other seniors clubs here in the city of Greater Sudbury. So if there's something that's a geography related, we'll try and refer people to their clubs and to the clubs in their areas.
Okay.
And tell them what activities are going on. However, they'll also have the options of what's here in Sudbury as well at the Parkside Centre, whether they want to do it remotely or come in person. Those are options for them as well.
Okay, so living in Cape Breton myself, it may be the Cape Breton Lions Club. It could be one of our programs here community-wise, curling club, somewhere where there's a volunteering initiative running. Okay,
Yeah.
thanks.
Yes.
So how are you spreading the word to other groups? Like, do you have, is it through email, flyers, or, because I'm just thinking, for myself too, how I could help spread the word. I like to do social media, as we all know. So,
well, this is one way to do it. We've just there was an article from McMaster University about social isolation just this week that was released, and so we shared that to our Facebook page, for instance. This interview is a way to do it, and presentations that we're making to specific healthcare groups should cover a lot of bases.
yeah.
Yes. And Dr. Zalan, who's not here unfortunately right now, has taken a really active role in outreach for this project. So he has he has some pretty good contacts in the medical field. So we're really fortunate that he sees the value in this project as well as we do.
Absolutely.
Yeah, for sure. Yeah. No, I think it's so important. I mean, of course, the demographic is growing. It's not diminishing.
Yeah.
We're all aging, and it's the wave of the big baby boomers is huge. There's a lot of people, and trying to keep people in their homes healthy as possible, rather than being institutionalized. And I think there's all these little pieces of the puzzle that kind of helps achieve that, I hope.
Yes. Well, that's one of our main goals is to promote the independence of seniors for as long as they can stay independent, and we have all kinds of different programs that are aimed at helping them for the various things they might face, whether it's, housekeeping or yard work or whatever. We have a lot of things in place. And we've tried in a lot of different ways to tackle this issue of social isolation over the years and combat the determinants of isolation. And we feel like this social prescribing is just the next step. It's a natural progression for us, and it's something that is really important.
Well, oftentimes people are reluctant to ask for help, right? They feel, oh, I can do it on my own. I don't want to bother my kids. I don't want to bother whoever.
Yeah.
But the idea that it's coming from a healthcare professional, I'm suggesting, here it is, here's your prescription to reach out. I think that gives it a different angle.
Yes.
It's an understanding that a patient visiting the doctor is not always a clinical issue.
Yeah.
Right? There are loneliness and isolation issues that are presenting themselves to the family physicians day in and day out. And hopefully this can help reduce that load on the physicians and reduce the number of emergency room visits and all sorts of associated issues. So if we can reach out to folks and get them some peers to work with them, it's a big benefit.
So if we have a viewer or a listener today that, when it airs, that is interested in participating, maybe being a volunteer, maybe they live in one of the areas that you're in need, how do they connect? Do they call Parkside? Do they reach out to on a website? Is there an intake? How do they say, hey, you know what, I really want to be here and I have some time, maybe they're recently retired and they want to support maybe some of those, key elements that you're looking for? Is there a way for them to connect with you?
Yes, for sure. Any of the ways you mentioned are great, Joy. Like the phone call is the easiest, probably quickest and easiest way to do that. Email or messages on our socials or on our website. They're all good ways to do that. And we don't turn people away. Hey, they want to help. We want to let them help. So
what's the best phone number, John?
That's 705-673-6227.
6227. And what email address would be the best one?
They can reach any of the staff here. So myself or Peter or Natalie Labby, we all have the same sort of email address. So it's just our name. It's john.riche@greatersudbury.ca.
Okay.
The same thing for Peter.Marshall or Natalie.Labby.
Okay, because I'll put those links in our posts and that too, to make sure that people have that readily accessible to them.
Awesome.
Perfect.
Because I think you may find too, there'll be many individuals as we, move into the next stages of our pandemic, and we move back to our new norm, where they've maybe been recently retired, they've just decided to, they're no longer, they just want to enjoy life to a different element, an element where they may say, hey, I've got a few hours to volunteer, so I want to give back to my community, or they feel how it was on their side of things, being isolated in themselves, and then now maybe understanding more about what it might be like to be an aging demographic, and someone who a little more seasoned than myself that had to be all of a sudden in this isolation. So I think I'm hoping we see more volunteers coming out in that 40 to 55, 60 factor.
Yeah, that'd be, no, I hope so too. And, it's really important when people are considering retirement that they have a plan in place to, because there's a lot of time that you now have to make up, do something.
Yep. Don't we, Gwen? Lisette and I are like, yeah, we're all looking at that retirement, but it's like, you got to have something else to fill that void. Like, you're still young and healthy. You want to retire. You need to do something. So programs like this is a wonderful initiative that say, hey, tap in. Spend 10 hours a week. And that comes to another question, is there any minimum time that somebody has to, or do they have, if they want to just volunteer 5 hours a week, is that okay?
Yeah, absolutely. We have a number of different options that for people if they're looking to spend some time here volunteering. So we have a number of different positions that we fill, and usually the 3-hour commitment a week is sort of the standard, base. Not
Peter's just joined us. Hi,
Peter.
Peter.
Hi. So go ahead, Joy.
We do have about 3.5 minutes left before we have to end today's episode. If Peter has anything he wants to add in before we close off, by all means, the floor is yours, sir.
No. Sorry.
I was just telling them, Peter, how you've taken an active role in outreach and setting up presentations with physicians and other groups throughout the community, and how well that's been going for us lately.
Yep.
Yeah, that's great to have the network of people that you can reach out to keep this program going, because it certainly has a lot of benefits to a lot of people. Yeah, well, we really appreciate you taking the time today to talk about that program, because when I was sitting in on the seniors advisory panel, you were probably there too, Lisette, and I heard about it, and I thought this is something that people need to know about, and certainly the doctors, the medical professionals, to encourage them to participate in it, and make sure that we can reach as many seniors as possible to prevent that isolation.
Well, especially with our aging demographic wanting to remain in their homes, sometimes it's not possible to know what's going on, especially right now where people aren't socializing very much.
Yeah, and we see the basic elements or basic who they call at risk are people who are over 80 and people who live in their own homes. So there's plenty of those in our area for sure, and not to mention all the other, determinants like geography or financial or transportation or whatever. So yeah, it is really, really important.
Mm-hmm.
Well, as we come to the last little bit of our show for today's taping of Aging in Action, is there any last words you'd want to share, or anything we haven't touched on that you think is really important or vital that you share in the next few minutes?
Well, I'd say, for anybody watching the program, that you don't have to be referred by a physician to take part in anything. And if you feel like, you don't have as much activity in your life or socializing in your life, and you feel like it's a bit of a void that you'd like to fill, you can certainly call us, and we have a lot of different ways, a lot of different options for people to attend our programs. And usually we have over 100 programs a quarter, so there's all kinds of different things that we can involve you in, and for little or no financial requirement, so anyways, so the phone number we listed would be good for that as well. 673-6227.
Perfect. Well, thank you all for joining us today on Aging in Action. We will definitely share all the information. We think it's an important initiative in our community, and I think all of us need to think ahead, even ourselves, when it comes to socialization. So thank you very much. We look forward to how this plays out in our community, and we'll be watching closely. So thank you everyone today for joining us with Aging in Action.
Thank you very
Thank you
much
so
for
much.
having.
Thank you.
Sorry about that. It was a little
Well
late.
done. Well done. Great job.
Yeah,
That was good.
I think
I
it's a
think
great program.
Yeah, and I think it's a really important, and I believe we're going to see a lot of volunteers coming out. I've just heard that with the group of, individuals at CRA that as we're retiring, and a lot of us are exiting out just, with working from home and the transitions, and we're all like, okay, well, what are we going to do?
Mhm.
Right? What are we going to do to keep ourselves busy as we retire in this 55 factor? So I think this is important, and I think it's a good way to I'm going to actually share some of that just on our next working in the building, and to say, hey, you guys are retiring. Here's some great programs in our community that
Yeah.
might be to your advantage to volunteer 5 hours a week.
If
Yeah.
they can
Right.
take a month off. They can be free for a month and then do something.
Yeah.
I think after a month, people will get bored. Yeah.
Oh yeah, like
And I
that's
mean,
just it, right?
It doesn't matter whether it's teaching a class or working the front desk or helping in the kitchen.
Yeah.
We're happy to accept it.
Yeah.
That's
Because I'm going to reach out to you, John, because I've been facilitating for Canada Revenue Agencies for in the last year because of our new way of things. And so I facilitate 20 minutes once a week mindfulness session,
Oh, nice.
just virtually in the world.
Yeah.
It's from here across the Prince Edward Island to participants, like there's participants from all over different tax centers across Canada. And, it's 20 minutes a week on a Wednesday morning of my time. Right. And it's just a great way to connect with others virtually. And it's just a mindfulness session, right? Like this
Yeah.
virtual
great.
yoga kind of thing. So I'll reach out to you because that's definitely something I'd be interested in. Mental health is important.
Yeah. Well, thank you very much, Joy. We'll be
I'll
happy to
connect.
that. Yeah.